Nice to be here. My name is Sanhitha Valasareddy. I'm a third-year medical resident at the University of Tennessee Health Sciences Center, and I'll be presenting a case report of multisystem inflammatory syndrome 9 days after the first dose of COVID-19 vaccine. Just a little bit of background. So multisystem inflammatory syndrome in adults, also called MISA, is a novel sequela thought to be related to the COVID-19 virus. And the CDC has a working definition ever since June 2020, and it's changed even since last year. Patient must be over 21 years old, hospitalized for over 24 hours, and must meet the following criteria, at least 3 of the following criteria, one of which has to be the primary clinical criteria. So one of the primary clinical criteria includes severe cardiac illness, including myocarditis, pericarditis, coronary artery dilatation, new onset right or left ventricular dysfunction or ventricular tachycardia, or a rash with non-purulent conjunctivitis. Secondary clinical criteria also includes new neurologic signs and symptoms, shock or hypotension, abdominal pain, vomiting, or diarrhea, and thrombocytopenia. There is also a laboratory clinical evidence of inflammation and COVID infection. And there also has to be a positive COVID test or current or recent infection. Our case study includes a 22-year-old African-American male with no prior medical conditions who developed MISA 7 days after receiving his first dose of the COVID Pfizer vaccine. The patient initially presented with general body aches, diarrhea, fever, documented in 39.3. He tested again for COVID-19 3 days after the initial vaccination, but was sent home that day to isolate for 2 weeks. And then 7 days after the vaccination, he comes back with fever, altered mental status, tachycardia, tachypnea, with a flat dark rash over his lower extremities up to his abdomen. He did have multiple elevated inflammatory markers, including lactic acid at 3.3, D-dimer at 3.5, CK elevation at 4,327, interleukin 6 was elevated at 18.5, procal at 8.16. And for treatment, patient was given 2 doses of IVIG, which he improved significantly afterwards and didn't require any sort of oxygen after that first day of admission. Patient eventually did develop a punctate area in the left occipital lobe, had an infarct, and he was thought to have an embolic stroke due to thrombogenesis from MISA. Eventually, he did show a significant improvement in mental status, renal function, respiratory status, and symptoms, and was sent home after 9 whole total days in the hospital. He made full recovery. So MISA is still relatively a brand new entity, and treatments were mostly extrapolated from MIS-C in children. Our patient improved tremendously after IVIG. So in conclusion, MISA is still novel. Treatments are largely still unknown. There, per my research, there's been at least 5 case reports of patients with MISA after vaccination in particular, making this pretty rare. And this might have been due to an overstimulatory effect of the vaccine on the patient's immune system who had already had the infection. All right, thank you.